This segment is sponsored by Pine Rest. As substance use and overdoses continue to rise, so does the need for treatment. Mariah DeYoung is a social worker from Pine Rest Christian Mental Health Services, and she is here to talk about Pine Rest's expanded offerings of services to support a person's entire recovery journey. And it's good to have you here.
Hi, thank you.
Are you seeing this uptick, this rise in numbers of cases, and can you identify trends?
Yes. So we still see the most for alcohol, people struggling with alcohol use, but it is definitely on the rise, all different substances, and that is why we expanded our program. We've more than doubled the amount of beds we have in our substance use program. We've also expanded our outpatient programming. We're starting a new partial program next month. So we want to meet the need of the community.
I want to tick through some of these areas where you have made some changes to the programming. Subacute detox, I'm not sure I know exactly what that is, but you've added some beds in that area.
Yes, we have expanded our care in the subacute detox, and that is where people stay with us usually about 3 to 5 days with 24/7 nursing care. So they see a doctor every day. That is the critical medical emergency of substance use and helping patients get through their withdrawal symptoms.
Short-term residential.
Yeah, so that's our next step after subacute detox, and people can be anywhere from a week or two to sometimes people stay up to a month. It really depends on how long they want to be with us and what their insurance coverage is, those type of things. And that's a program we've been able to expand. It's now in a house and around the corner from our main campus, and we patients can go out on outings. We have technology so they can have Zoom meetings or Facebook meetings with their family. We have an exercise room, a lot of different things, because they are going to be with us a little bit longer.
Okay, then you have a partial program. This is kind of an intense daily program. Describe that.
Yeah, so that's we're expanding that next month, and we're really excited. And that's going to be a Monday through Friday, specifically focusing on substance use. We haven't had that before, where the focus is 100% on substance use. So people come just during the day. They'll see a doctor if needed. They'll check in with a nurse in the morning and attend clinical programming. So don't need to stay the night with us, but need that intensive of I need to see a doctor. I need some help every day for a little bit. That's usually a week or two program, and it's great for patients who are stepping down out of the residential program, so they can get used to going home, seeing their family.
Nice. Interventions. I guess I didn't really know that was a thing, but it really is.
It really is a thing. So we have a trained interventionist on staff now. So if you have a loved one or a family member who is not willing to get into treatment yet, we want to support you in figuring out how to get them the support that they need.
So talk a little bit about how these programs kind of wrap around a person and support them in their entire journey. I hear you describing how you step from one to the next.
Yeah.
Is that what it is, kind of a progression through those?
Absolutely. So that is one of our goals at Pine Rest, is to have every level of care for substance use. So it doesn't matter where you're at in that level of care, what you need, we offer it all. And it's with our whole team. So you get to know us, you get to know the programs, and then you don't have to start over when you step from one level to another. You're still part of the journey with us. And all of our services are also offered telehealth, except for the medical needing nursing. We can't do that virtually, but all the other ones are offered telehealth. So it doesn't matter whether you're coming from all across the state, you can continue working with the same therapist and doctors that you started with.
I imagine the getting started is the hardest part.
Yes.
How does one get started?
So you can call the office. Family members or the patient themselves can give our office a call, 866-852-4001, or go to pinerest.org, and that'll have all of our different services. But really the first step, call, set appointment. We'll meet with a therapist who specializes in substance use, and we'll let you know what level of care you need and how to do that.
Very nice. All right, the phone number is right there on the screen. Also, again, the website, pinerest.org/addiction. We'll put all that information on our website, 13onyourside.com. Good to have you here, Mariah. Thanks.
Thank you.